Hi everyone, this is Victoria Stevens back again for the case study module. So yeah, let's just get started. Hello everyone, and thank you for coming to this year's medical conference where we encourage health education and embrace new research. My name is Dr. Victoria Stevens, and I am the lead neurologist at Dallas Neurology and Sleep Clinic. My daily task as a neurologist consists of studying the nervous system. Today I will be discussing epilepsy amongst patients diagnosed with anxiety. Over the past year, I've seen an increase in this disorder in about 1,000 anxiety patients. Epilepsy is a disorder in which a patient has recurrent seizures that stem from a small part in the brain that affect both hemispheres. With this disorder, one might experience loss of consciousness, muscle contractions or convulsions, temporary amnesia, and drowsiness. In the past, I would utilize different methods of treatment for this neurological disorder due to the simple fact that epilepsy does not occur in just one part of the brain. In order to lay out a treatment plan for the patient, I would first need to conduct an EEG exam that measures the brain's electrical impulses. This test is utilized to find any unusual brain activity that will determine if the patient has epilepsy or not. To see what is then causing the epilepsy in general, I would conduct a simple CT scan. If the results from these exams show that the patient does indeed have epilepsy, I will prescribe them with the correct medication for X amount of time, depending on their severity. One case in particular is about a 22-year-old Caucasian woman who has been a patient with the Dallas Neurology and Sleep Clinic since August 2013. The chronic conditions are anxiety and lack of sleep. She is a fully functional student who can take care of herself. However, in November 2013, the patient experienced paranoia and anxiety, which was caused by her lack of sleep. She claimed that she would get no more than 4 hours of sleep, which is way below the normal sleep requirement for someone her age. The patient has been on anti-anxiety medication since November 2013, which normally would reduce anxiety levels. However, due to increased stressors in her personal life, the patient has developed epilepsy. I strongly recommended patients to start another effectual drug therapy that is an anticonvulsant, as well as find something that prevents anxiety. Also, I encourage the patient to try to avoid severe stress that can trigger her anxiety and cause her to have a seizure. In general, stress-prone epilepsy is something that is hard to control due to the fact that stress is something we all go through. However, this is much more difficult for these patients who already have trouble managing their anxiety. My recommendation for this issue is to encourage patients to express their emotions in a more positive way, avoid severely stressful situations, practice breathing techniques, engage in yoga and other helpful exercise methods, and try to maintain a stable sleeping pattern. Again, my name is Dr. Stevens, and I thank you all for listening, and I hope you all learned something today.